Hi, my name's Dr. Ross Hauser. Welcome to Caring Medical Florida here at the Hauser Neck Center in Fort Myers, Florida. Great to have you. Boy, I see a lot of strange symptoms. So internal trembling is one of those. You know, it's described different ways. I have patients saying, Doc, it's as if my whole body's vibrating, or I get this trembling. Some people even get fearful, like they're going to die or some terrible thing's going to happen, because it's basically your body's doing something and you don't have any voluntary control over it. But the best way I can describe it is internal tremors. Like, in other words, there's something inside of the body that's giving a sensation, and it can be continuous, or it just occurs with a certain position. So whenever I hear somebody say that I have a trembling or I have vibration, like my body's vibrating, I right away think of spinal cord tension. So there's lots of different causes of internal trembling or vibration sense within the body, like the body's zzz, like there's something going on in the body. There's various causes of it, but the most common thing we see is that there's spinal cord tension, and the spinal cord tension is normally in the cervical region. I'm going to start with this slide, and I'm actually going to end with this slide. So, causes of spinal cord tension and treatment options. When the cervical and thoracic curve is normal and instability present, the treatment's prolotherapy, meaning that for the most part, when we x-ray the person or we do digital motion x-rays, the cervical curve's pretty good, but there's some horrific kind of instability. So the vertebral bodies are moving way too much, and that can give intermittent spinal cord tension. So the person would usually have intermittent symptoms. Like, I'm just telling you, Doc, when I'm at work and I'm standing, I get this horrible vibratory sense, or I'm laying down and I get this horrible vibratory sense, but they can get in a certain position. So I'll just give you one little thing that would occur with me. Now, I've had the internal trembling in my past, and I've also had, and this will kind of explain it, and this is just a little symptom, but Mary and I, for years, we went to Calvary Church in Oak Park, Illinois, and the pastor was Pastor Ray Pritchard. Wonderful man, Ray Pritchard. So then the way that church was, you actually had to look up. Like, I had to look up, at the pastor during the service. And let's be honest, there's pastors, they go on and on and on. Now, Pastor Ray, he was very interesting. But you would see me about 20 minutes into it, you would see me go like this. Like, you would see me for about 10 or 15 seconds. Instead of looking up, I would look down. Well, basically, at about 20 minutes into the service, all the time, I'd get like a tingling, a vibration down my right leg. And then all of a sudden, I would look down. Looking down, it opens up my spinal canal. And then all of a sudden it would stop and it wouldn't recur. So in other words, the way my neck curve was at the time, if I was looking up, what would happen is the spinal canal would narrow as the time went on, and that would give me spinal cord tension and give me some internal trembling that would just be down my right leg. And all I had to do was look down and open up the spinal canal. Now, obviously, I haven't had that in a long time, so I got some prolotherapy, did some curve correction, and I feel much better. Now, so that's the first one. So there are people that have cervical and thoracic curves that are dysfunctional and instabilities present, meaning they don't have a normal thoracic or cervical curve. It's a little bit dysfunctional, but they also have instability, and we document instability by a digital motion x-ray. So those people need prolotherapy plus curve correction. But there are people that they just have a horrible curve. In other words, when we move them, there's no excessive motion. It's just the curve's terrible. That's giving the spinal cord tension, and they just need curve correction. And this is some of the stuff we see. Like, here's the spinal cord. Here's the cerebral spinal fluid around it. Don't you agree? There's some spinal cord tension there. Like, look at the disc herniation, the way the vertebrae are. This spinal cord is just getting annihilated. So that kind of a person could have all kinds of symptoms, all kinds of internal trembling, or just symptoms down the leg, or just symptoms down the arm, or vibratory sense all over their body. Now, this is sometimes what we see. See how there's an indentation right here? Well, when we did the digital motion x-ray, you could see that their C4 vertebrae was not in the best position. Like, in other words, this was primarily because of where their C4 vertebrae was located. So by doing an adjustment, by doing cervical curve correction, the spinal cal widened, and so did the tension. The tension then decreased off of the spinal cord. And again, there's all kinds of ways to get ligament damage. So if you have had internal trembling and this occurred like after a car accident, after a head trauma, after an athletic injury, or you're a student and you've just been studying and looking down, well, maybe you should get a cervical spine x-ray, and instead of your cervical spine looking like this, maybe it looks like that. Well, that's going to give a whole bunch of tension. So this is a lateral view of the x-ray, and you could see, like right here, there's a kink right here. So the person's going to get spinal cord tension there. And then this is on an MRI. This is how it's supposed to look. See how the spinal cord is nice and round, and there's lots of cerebral spinal fluid around it. But basically, when you look at your own MRIs, you're going to see that in the neck, if your cervical curve has been destroyed, what you'll see is instead of this round, the spinal cord becomes oblong or oval, and it can even have all kinds of weird appearances, and that's spinal cord tension. And spinal cord tension can give you numbness. It can feel like the top of the body is not connected to the upper part. When you're walking, it could feel like you don't have good control of your legs. It can cause numbness. It can cause buzzing. It can cause a vibration sense. So think spinal cord tension when there are unexplained symptoms in the arms or the legs, including whole body vibration or internal trembling. Spinal cord tension is easily seen on CT and MRI scans as the spinal cord goes from a nice round configuration to a pancake or oblong shape. Symptoms can be relieved from spinal cord tension when instability is resolved or the spinal curves are optimized. Most of us, if we're honest, we're too hunched over in the thoracic spine, and then we got some crazy forward head posture. So those things need to be corrected. And again, this is what we see a lot of. Instead of a nice lordotic curve, this is called an S curve. See how it's like a snake? So I term this cervical destructure. So cervical destructure is destruction of the cervical curve. So we need to optimize this person's curve by doing curve correction. So when you get spinal cord tension, the part of the spinal cord that does vibration sense or skin sensation, that can be irritated. So it's as if the person's feeling vibration or they're feeling buzzing. So I've had all different kinds of things. People have told me, well, it's like insects crawling on me. It's a buzzing, it's a hissing, it's an irritation, it's an itching. I've even had where it's an itching. All these things can be from spinal cord tension. Now, another thing you can look at, this is a thoracic cervical MRI. Now, see the spinal cord right here? See down here where there's cerebral spinal fluid on both sides? But see here, it's basically laying right on the vertebrae, right? It's supposed to be in the middle here. So if you've had an MRI, and most of the spinal cord tension occurs in the neck and at the cervical thoracic junction. I mean, this thing from here to here, it's just going to be unbelievably amount of tension, because it's basically, instead of being in the middle of the spinal canal, it's literally this person's spinal cord is laying on the bone. You know, and that's not a good situation. Most people don't realize the spinal cord normally with motions undergoes quite a bit of movement. So imagine if a person has their curves, their thoracic curve and their cervical curve are such that it elongates, right? That's what happens. The vertebrae separate, like when you look down at a cell phone. So imagine if the cervical vertebrae are elongated all the time because somebody has a bad curve. Well, it means the person could have tension on their spinal cord all the time. And at some point, it could be so severe that it's as if the body is trembling all the time. So the treatment is, you know, get the shoulder blades back, so reduce the thoracic kyphosis. So I just think if people would just have the proper setup at work, if you work on the computer, have the proper setup at work so you raise your chest when you're doing computer work. That's going to get the thoracic spine in proper alignment, get your cervical spine in proper alignment. And then when you're using your cell phone, why not lay on your stomach? Like lay on your stomach and extend your thoracic spine. You know, like this morning, you know, I was actually reading a book and I was laying on the floor, the hard floor, and I was laying on my stomach reading, and that helps increase the musculature here, increase the musculature here. You know, because I'm hunched over all day doing prolotherapy, so I also have to work on decreasing my spinal cord tension. And again, the spinal cord, I showed you an example where the spinal cord was laying on the front of the vertebrae. Here it's on the back. See all the cerebral spinal fluid here. There's no cerebral spinal fluid here. And then on cross section, look at that. It's basically sitting on the vertebrae. So the back of the spinal cord here easily can get irritated, and that's where vibration sense or trembling sensations can stem from. Any sort of instability can affect the spinal cord. So this is just an example of instability irritating the nerve, irritating the spinal cord. So if a vertebrae is rotated in the wrong way, if there's instability or excessive motion, that can irritate the spinal cord. And if the spinal cord is under too much tension, the nerves are going to fire. And on MRIs and CT scans and the like, you can measure the amount of space, and there definitely are some of you that you have spinal stenosis, like the space is so narrowed. So if you have a narrowed space, all it takes is a little bit of instability because the space is narrowed, and then all of a sudden you got excessive spinal cord tension, where somebody else might have a really big spinal canal and maybe a smaller spinal cord, and they could have like a lot of instability and not even have a lot of symptoms because there's more room. And again, this just illustrates it, especially the atlas, if it's malrotated, it can irritate the spinal cord. And again, when there's a terrible curve, no instability, curve correction, when both are present, instability plus a dysfunctional curve, prolotherapy plus curve correction. And then if somebody's curve is reasonable and there's just instability, they just need prolotherapy for internal trembling. And I would just say that the prognosis is very good, because if it's from spinal cord tension and the spinal cord tension is addressed by appropriate curve correction and prolotherapy, the prognosis is very good for improvement. And definitely have had patients in the past where they're completely free of any internal trembling that they came with.